Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Welcome to the AAOMPT podcast. My name is Leanna Blanchard. I am very excited to present today's guest coming off of a very successful presentation in October at the AAOMPT annual conference in San Diego. I would like to give a big welcome to Alexandra Anderson, Jamie LaPenna, and Dustin Willis. These three were members of the team presenting a session titled The Imposter Within Us: Prevalence, Predictors, Impact, and Strategies for Physical Therapists. Just to give you a little background on each of these incredible people, Alexandra Anderson is a board-certified orthopedic clinical specialist with over 6 years of clinical experience treating in both private practice and outpatient hospital-based settings. She graduated from Loyola University in Southern California and moved back east where she worked in Washington, D.C. for 2 years prior to relocating to Chicago to complete UIC's Fellowship in Orthopedic Manual Physical Therapy. She also holds certification as a myofascial trigger point therapist, and currently Alex works full-time at the University of Illinois at Chicago and is the founder of her own private practice, the Physical Therapy Academy, offering patient care and continuing education. She's presented at national conferences, published case reports, and contributed to authoring 2 book chapters for manual therapy of the hip and knee. Alex engages in academia by participating as a lab instructor for physical therapy and medical students at the University of Illinois at Chicago, as well as assisting and mentoring in Northwestern's fellowship program. Jamie LaPenna is also a board-certified specialist in orthopedic physical therapy with over 10 years of clinical experience with an emphasis on spine disorders and persistent pain. She graduated from Northwestern University's Department of Physical Therapy and Human Movement Sciences in 2009, and in 2018, she also completed a fellowship in orthopedic manual physical therapy from the University of Illinois at Chicago, earning recognition as a fellow of the Academy. She's presented at 2 national physical therapy conferences and participates in abstract reviews and mentoring. Jamie currently works as a full-time clinician for Loyola University Medical Center near Chicago. And Dustin Willis, last but certainly not least, is an assistant professor in the Department of Physical Therapy at West Coast University. He received his Doctor of Physical Therapy degree also from Loyola University. He has completed several advanced training programs, including an orthopedic residency program at Rancho Physical Therapy, the Kaiser Permanente Southern California Sports Fellowship, the Lower Extremity Biomechanics Fellowship at the Movement Performance Institute, and the Azusa Pacific University's Movement Performance Fellowship. He's currently working on his PhD with a dissertation in investigating the underlying physiological mechanisms of the therapeutic alliance. Thank you guys so much for being here today. I'm really excited to have you. And those were some long bios for some very impressive people.
Leanna, we actually made our bios purposefully grossly long to then say that we all suffer from imposter phenomenon.
Love that motivational hook. Thank you all for joining me.
Thanks for having us.
So I thought we could just start if you could maybe tell me a little bit about kind of the inspiration for this project, or maybe each of you could just say a few words about why this topic is important to you and how this came to be.
Well, I think when COVID hit, there was a lot of kind of existential crisising happening with what's going on in my life, what am I doing? And Alex and I talked a lot about burnout and feeling a lot of, frustrations with kind of where we were going next and everything going on. This is definitely something that I have always dealt with, and I think it motivated me to pursue all of the credentials that you talked about in the bio, which is lovely. But I think I just never talked about it. And luckily, with Alex, we were able to have a really honest conversation about it. And we decided, okay, we're not alone. Maybe we need to talk about this with more people.
Yeah, so actually, in our presentation, I told the story of my first day of fellowship and how I couldn't believe I was sitting at the table with the 9 other brilliant fellows in training, which obviously were 2 of you, Leanna and Jamie. I really felt like I was there by mistake and was feeling so lucky that I got to be there. Part of the reason was that the majority in the room had their OCS and had been through residency training. And it wasn't until I spoke with you, Leanna, about these mutual feelings a few years later that I realized I wasn't the only one feeling that way. And then to echo Jamie, when we really started discussing this during the pandemic, when we were both feeling burnt out, we had a live discussion on this topic on Instagram. And the feedback from other people watching it was so overwhelmingly positive and supported the theory that the majority of people felt this way. So Jamie really had the idea to push this even further, which was really cool.
We really needed a poster child, so that's when I came on board now. Alex and I stayed connected. We weren't classmates at Loma Linda, but we knew each other. I even remember having a conversation with Alex when she was contemplating doing the fellowship because she knew I was doing all these crazy things that were completely driven by imposter syndrome. And so, kind of doing all these things, going along. And then I started in academia. And there was just such a dissonance between this pedestal the students were putting me on because of all these crazy things that I'd done and letters behind my name. And like, I don't even know what to call it, but the feedback from more well-established peers in academia, faculty members, and it just left me feeling so confused. And Alex approached me and I was like, yes, please, let's do this.
Awesome. I love that you all have these really great personal stories to tell about why you feel like this is important. I think the best projects come from the things that we have a personal passion for. So that's really awesome. I would love to just kind of get an overview of what imposter phenomenon is and what the existing literature says about it.
Dr. Imes and Dr. Clance, both psychologists, first coined this term in 1978 when they were going through graduate school and feeling as though they weren't good enough. In their research, they found that people either overestimate or underestimate their abilities, which is funny because I feel like I do both actually. But anyway, they discuss imposter phenomenon in high achieving people as this internal sensation of feeling that you aren't as smart, successful, talented, as able as other people view you as. So exactly what Dustin was saying. Of course, if that is the idea you live with every day, then you are in this constant fear that someone will find you out. So you've basically diminished all of your achievements or objective successes to good timing or luck, and you are still faking it to make it. What we know in the literature is that this affects both men and women in multiple professions of many ages. We can see that anxiety and depression are common comorbidities, along with low self esteem. Much of the early literature focused on women, but we can see from a systematic review by Barada and colleagues in 2020 that half of the included studies that reported evaluating a gender effect found no difference in the rates of men and women. There are numerous studies showing this to be prevalent among ethnic minorities, but a lot of these studies are limited in the diversity of their participants. And when it comes to age, we might assume that older individuals, which usually comes with more experience, are less likely to experience imposter feelings. But again, in the same systematic review, they found that the literature was essentially 50-50 on this, but they included reports on students and not just employed populations. And then specifically in the healthcare community, we see moderate or high imposter phenomenon in physicians and nurses. And we see this having a harmful impact on job performance, job satisfaction, burnout, personal, mental, and physical health, and personal and professional growth. So knowing all of this, we were curious about imposter phenomenon within our profession, and there was really nothing to inform us, specifically in physical therapists, when we tried to look at literature.
It's amazing there's not really anything on imposter phenomenon in physical therapists just yet. So Dustin, why do you feel like as a profession, physical therapy should be paying attention to this?
Because, well, we just talked about all of us having experience with this, right? And I know each and every one of us know anecdotally that this is something that so many people are dealing with and battling with, like from the students that I currently teach to all my colleagues, whether they've done advanced training or not. Just so many of us out here are having these feelings of inadequacy, or maybe we don't really feel like we belong where we are. And it's just something that I feel our profession has to catch up on. I feel like there's a lot of things our profession has to catch up on. But again, we're kind of in our infancy in comparison to some other healthcare professions out there. So not too surprising.
I 100% agree. I think that's a really good point that even from students all the way up to the level of faculty, people at each level of experience and level of knowledge are probably experiencing this. And just reflecting on that, I can think of feeling that way when I was a student, feeling that way when I was a resident, when I was a fellow in training, now also as a faculty member. So I think you're absolutely right that this is kind of happening at all potential levels and could be something that we could really hopefully tackle as a profession. Alex, you mentioned in the presentation at AAOMPT that imposter phenomenon is not actually included in the Diagnostic and Statistical Manual, the DSM, and it doesn't have any sort of ICD code. So what barriers does this present to us as clinicians or as researchers in this realm?
Yeah, that's a great question. I would say so outside of the academic literature, you may hear imposter phenomenon referred to as imposter syndrome, and it's been widely discussed as this, especially in the context of achievements within the workplace. And again, you can read more about this in the systematic review by Barada and his colleagues. But as of 2020, when they published this review, there had never been a published systematic review of the literature on this. So they thought the reason behind this may be because it is not officially recognized as a clinical diagnosis. So perhaps this just may limit the evidence in regards to recognizing it and treating it, along with understanding more on prevalence and comorbidities. But I will also say I've read some things too that because it's just this internal feeling and you're kind of going based off that it can't be a diagnosis. So I'm not sure, but these are some of the things that are coming up in the reading. So it's a great question, but I do think it kind of limits our ability to maybe study it a little bit and put out some research.
Could add to this too, if you view it from a phenomenological perspective, it's kind of invalidating, right? Like, oh, that's not really a thing. That's not a real diagnosis. It doesn't exist in all of the diagnoses that you can be given from a healthcare professional. So it makes it hard when it can be seen as not a real thing out there, even though so many people in the world in our profession are dealing with this day in and day out.
Yeah, and actually further to add to that, it's kind of like with us whenever we're treating a patient in the clinic that maybe doesn't fit, a standardized objective clinical pattern, right? In some cases, you can just find yourself treating the symptoms and a lot of the comorbidities that are present in imposter phenomenon, like anxiety, depression. I think we end up focusing on that. And again, it's just one piece of the puzzle instead of putting everything together.
It's a great way to look at it. And on that note, Jamie, I'm wondering if you can tell us a little bit more about kind of what the types of imposter phenomenon are or how we might recognize those symptoms.
So it's weird because either people talk about it in general or they talk about these five types. And by they, I mean there's really one professional who talks about it. That's Dr. Valerie Young. She's the internationally recognized expert on imposter phenomenon. She actually has an imposter syndrome institute that she's a co-founder of. And she wrote this book called The Secret Thoughts of Successful Women: Why Capable People Suffer from Imposter Syndrome and How to Thrive in Spite of It. And so, through her research that she did to get her educational doctorate, she really studied successful women and what was sort of limiting them in thriving in their careers. And so she kind of found and coined the five types that we talked about. So there's the perfectionist. And also I will say that I feel like a lot of us can identify with more than one of these types, which they also talk about as being normal. So there's the perfectionist who sets ridiculously high standards, unrealistic goals, pretty much never satisfied with those achievements. really focuses on any of the flaws or the things that went wrong in an otherwise perfectly acceptable project or outcome that they've produced. There's the expert. So, this person who is pretty much equating one's self worth to the amount of knowledge that they possess. So, they really never feel like they know enough. Then she talks about the natural genius, which I also think it's weird that there's the expert and the natural genius as types of imposter phenomenon. The natural genius feels that any talent or intelligence that you get is pretty much something that you're born with. So success should be easy, it should be fast. And if it's hard, it's obviously because of something that you don't possess, it's because of you. For there's the soloist, so this person pretty much likes to, go it alone. Needing any help pretty much means that you're not capable, and you might be the kind of type of person that might not want to actually seek out mentoring or feedback, because if you were really smart, you wouldn't need it. And then finally, there's the superhuman, which this one's kind of the funny one, but it's pretty much types 1 through 4, but elevated. And this person pretty much feels that you should be able to juggle, any role. So mom, wife, academic, professor, clinician, you should be able to do it all, and you should be able to be the most successful in all of it. And your worth is equated to how well you can juggle those things and make it look easy. So the failure to be perfect evokes shame.
So I'm going to ask all of you a somewhat vulnerable question. If you had to identify with an imposter phenomenon type, which one do you identify with?
Well, I love a vulnerable space.
Vulnerability Club.
I will take that vulnerability invite. I mean, I think that I identify with a lot of them, but the one that I probably most identify with is the perfectionist.
I'm gonna say the soloist is the one that most fits me.
Oh, I'm superhuman for sure. 1 through 4. Look at everything I'm trying to juggle. I'm the poster child.
Wait, Leanna, what are you?
Thinking about that, I think I'm probably a combination between the expert and the perfectionist. So you guys kind of started pondering this project and pondering what imposter phenomenon means to physical therapy, and you developed this survey that you had sent out, and you got quite a few responses, if I remember correctly. But if you could maybe just tell us a little bit about how you designed the survey, sort of what were your goals going into it, what was your hypothesis going into it?
Yeah, so we actually had the privilege to meet virtually with Dr. Holly Hutchins to discuss imposter phenomenon. We were reading a lot of her research, and she speaks openly about her experience with this on a TEDx talk. And we had all watched that as well. So it was really cool to meet with her. And she gave us a lot of insight on which outcome measures we wanted to use. So we decided to measure the level of imposter phenomenon using the Clance Imposter Phenomenon Scale, which is 20 items. And then we used the subcategory of emotional exhaustion on the Maslach burnout inventory, which is 9 items to measure burnout. And the reason we decided on that subscale is because in the literature, we see this as being the greatest predictor to burnout. And then we used the 3-item job satisfaction subscale, which is a part of the Michigan organizational assessment questionnaire. And then once we scaled these outcome measures, we wanted to compare each person's score to various demographic information that we suspected might be a predictor. So the big ones that we have been looking at in the literature, at least in other professions, are age, gender, race, years of practice or experience, and anxiety, depression. But we were also curious about degrees and certifications. We know there's a variety in PT, right? And then all of us have gone through all of this advanced training. So we thought that there might be a correlation there. And then we also were curious about practice specialty or practice setting, and then the hours spent with direct patient care. And there's more as well. But those were some of our initial thoughts.
So then tell us a little bit about the results of the survey. Were there kind of any surprises in terms of the prevalence or the predictors, or things that you thought would be predictors but ended up not being predictors? Just kind of give us an overview of that.
Yeah, for sure. So the outcome measure, so the Clance imposter phenomenon, you grade it on a scale. So there's 4 categories, and you land in the low, moderate, frequent, or intense category. So to me, it wasn't surprising that the majority of physical therapists, at a whopping 89.3%, experience moderate levels of imposter phenomenon or higher. But it was surprising that the majority of PTs, at 42%, experience this frequently, which is the second highest category, number one. And then number two, that 51.3%, so just over 50%, had frequent to intense feelings. And those are the 2 highest categories. So we're seeing that the majority of PTs have it at least moderately, and that the there's quite a few that are experiencing this at a frequent or intense level. As far as predictors go, younger age, cisgender women, less experience, less time in the current position, and potentially degree. We saw that bachelor's of science was more likely, but there was also a very small group of those people, so not really sure. And then mental health diagnosis, lack of management experience, which I thought was interesting, and higher burnout. And then as far as not being a predictor, actually the credentials, so specialties like any ABPTS specialty and a fellowship certification, was not correlated or not a predictor. And that was a little bit surprising to me. For me, at least, I really didn't have an expectation for gender orientation or identity, because there were no strong trends in the current literature. And that was matching up with a lot of the people that I was talking to about this. I did, however, again, hypothesize that more degrees or certifications might be related to experiencing more imposter feelings. And so therefore, I thought years of practice and age might also.
Yeah, and I think also it's good to highlight the managerial experience, because that was something we were like, oh, okay, what does this mean? But the fact that most people in our study that have, the imposter phenomenon or test for it, they don't have managerial experience. And going back to this, it's kind of one of the reasons why it's important that we look at this, because it's known that imposter phenomenon can really limit your career thriving and your career striving. So you may be avoiding opportunities to elevate yourself simply because of imposter phenomenon and you never knew it.
For sure. There's like a lot of cross sectional relationships that we see here. We want to blame it totally on imposter phenomenon. We can't, we don't know that for sure, but it is an interesting question, like what came first.
And I thought it was interesting too. I think you mentioned in the results that there's a bit of a cross-sectional relationship between imposter phenomenon and burnout as well. So it's like, does the burnout cause you to have imposter feelings, or do the imposter feelings cause you to feel more burnt out? And I thought that was just an interesting thing to ponder.
Yeah, the other interesting thing too is that burnout progressively increased. So like the more intense feelings at like each stage, burnout increased, but job satisfaction stayed the exact same across the board. So we're like super satisfied at being very emotionally exhausted and imposter like. But yeah, so we're a passionate bunch. Basically, we're going to keep giving it our all because we love what we do. But at the same time, we're feeling like we're not good enough.
So I know you had mentioned that in the literature that the kind of prevalence of imposter phenomenon was pretty 50-50 for men and women once they started looking into it a little bit more. But in your survey, of which you had over 500 respondents, you did find that being a cisgender woman increased the likelihood of imposter phenomenon.
Yeah, really interesting. Someone at the talk asked me why, and I just wanted to say, misogyny and chalk it up to that, but actually there's so many things to break down here. And what I've read too is that men might experience it but not know that it is imposter phenomenon that they're experiencing and not be able to express that. And then the other thing that I've read in the literature was just back in, again, like 1976, so this is pretty old, but there was a researcher who looked at sex differences in the attribution process. And she points to considerable evidence that women consistently have lower expectancies than men of their ability to perform successfully on a wide variety of tasks. So, unlike men who tend to own success as attributable to a quality inherent within themselves, women are more likely to project the cause of success to an outward cause or an external cause, such as luck, or to a temporary internal quality or such as effort that they do not equate with their inherent ability. And then conversely, women tend to explain their failure with lack of ability, whereas men more often attribute it to the external cause. So failure to luck or to the task difficulty. So, given the lower expectancies women have for their own and potentially other women's performances, they have apparently internalized into a self stereotype, the societal sex role stereotype, that they are not considered competent. And since success for women is contraindicated by societal expectations and their own internalized self evaluations, it's not surprising that this has come out in some of the research. So I think, that they might have to find explanations for their accomplishments other than their own intelligence. So it's interesting, and I don't know if this has this is still the reason why. Again, this is kind of like one can only presume or guess, but this is some of the literature that's already out there on studying sex differences in this attribution process, which is really interesting.
All right, so I have a thought here. Of course, there's a lot of factors at play, but if we think about the question you asked a second ago about us maybe having a vulnerable moment and picking which category we fit in best, if this group were three males and one female, I don't know if that conversation would have been the same because the influence of culture and society, us males just generally aren't as comfortable going there, right? And it reminds me of an anecdotal example of a friend of mine who was in academia with me at my start in academia. And he was that guy, that sage on the stage that was a walking encyclopedia. And I was constantly comparing myself to him, like, oh my gosh, I would never compare to this person. What am I doing here as a professor? I don't belong here. And so he would just constantly put off this aura and this presence of like, I got everything figured out. I know all the answers. I'm God's gift to PT, right? But finally, after we got a little closer and it kind of broke down those walls and I got him to open up a little bit to me, we were struggling with the very same things. We were just dealing with it in opposite ways. So maybe some of our respondents, because if you think about, again, I hate to use stereotypes, but stereotypically, what do we envision a PT? Like this former athlete, type A personality. A lot of us are males. And so maybe some of our respondents just weren't ready to go there just yet.
Yeah, I think that's a valid point. I mean, really all of that is self-report, right? And I think generally PTs we're all pretty smart people. So if we see a question, we can sort of tell what it's trying to ask us. And I think you're right. If we're not ready to maybe acknowledge some of those thoughts and feelings, then that could certainly skew the way that someone fills out the survey.
And if you like piggyback off of what Alex said too, just think about again the structure of our society and the culture in which we live in, and all the barriers there are to a female being high performing and successful. So it makes a lot of sense that being a female that actually achieves that level of high success, you start to doubt if you really belong here because you've had to work so much harder to get there than a lot of your male counterparts. So
Well, I think it's interesting too, because physical therapy has always been largely female dominated. And I wonder what that means as far as, how this originated and what was caked in at the very beginning of it. And now too that we are at a more advanced level. So the majority of our respondents were DPTs. So the majority had their doctorate. So it makes me think about it. It's a great question. I think it's an important question. Of course, as we do more research, we get answers and then we have a million more questions afterwards. And so I think that was really our goal, was to open up the conversation and get people talking about why, because the why is really important, and if we don't ask it, we won't change it.
And I think that goes back to what Jamie said earlier about just treating the symptoms versus examining the why and getting to the root of what is actually causing the feelings in the first place. And I think really all of this is also kind of an interesting parallel to how things have presented themselves even with the podcast. So, starting out a few years ago, the sort of founder of the podcast, Schaefer, eventually noticed that the male to female guest ratio was really off. He was hoping, obviously, for more of a 50-50 split. And initially, when the podcast was started, really tried to be unbiased when screening for potential guests, focusing on things like what journal was it published in, what's the topic, what's the title of the article, the quality of the article, and just trying to be as non-biased as possible with respect to things like the author's name or the country that it came from or the sex, or if it's someone that they know or you have an opinion about their work. So Schaefer acknowledged that in trying to be unbiased, we actually ended up with a ratio of 41-16. So then only 28% of guests by August 2020 were female. So he started kind of looking into it a little bit more. And like you said, Alex, despite our profession being female dominant, it turns out that male authors or presenters are far more represented in publishing or presenting. So I think there's still a lot of opportunity to deep dive into those numbers, but I do think it's reflective of what we're seeing here.
Yeah, I'm so happy you shared that, Leanna, because these are some of the things that if people don't know about them, they just assume that everything is, equal and normal, and it's just not something that's talked about. And again, like, why did that happen? Like, was there, less women putting out the research? We don't know. Like, we have to ask more questions.
I will say we are at the podcast actively trying to correct that ratio. And we often run into some interesting obstacles where, even if we contact a corresponding author that happens to be female, but maybe they note that a male colleague is the one that's better suited to come and discuss it, or if it's a senior author versus primary author type situation. So, even though we may be inviting more females, we may not always get a female to come interview. What was shared with me is that as of conference in 2021, the ratio had improved to 40% female, which is quite a jump from 2020 at just 28% female. And then as of conference this year, it was bumped up to about 43%. So we've kind of been at this 3% correction per year now, and we hope to kind of keep that going.
Yeah, big kudos to Schaefer for finding that info and then making or putting forth the initiative to correct it. That's awesome.
Yeah, absolutely.
So we've already kind of considered some potential strengths and limitations of this project. But Dustin, I'm wondering if there's anything else specific that you'd like to share that you think is really a key strength or a limitation that you encountered here.
I mean, we've kind of already said a lot of it, like you said, but just the fact that it was a large sample size, I think, was a great strength. And really, we're one of the first ones to investigate this, which is pretty cool, but also kind of sad in the same breath. We're also aware of some colleagues that did similar work and presented at the educational conference where they included students, but we were really interested in practicing clinicians and particularly those that had advanced training. I would say limitations wise that we don't really know what our survey response rate, right? And we didn't tease out anxiety, depression with self-reported questionnaires. And because we were, kind of just getting into this, we didn't run a ton or any covariates, like really looking at the relationship between being a female that has advanced training or combining some of these factors together to really get a good look at what the picture of imposter phenomenon looks like out there. And those are kind of the big things that come to mind. But opportunities for future research, right? When you complete research, you're often left with more questions than answers. And I think we have a lot of questions just off getting this first one done.
I'm looking forward to maybe what future questions you all start to try and answer. I think that'd be great.
Yeah, and we do plan on running multivariable, multinomial regression to account for correlated predictors. So hopefully we'll have some updated information and be able to present this again.
So now that we've talked a lot about the prevalence that we found and the predictors that you found, I think I am left, and I'm sure listeners might be left with wondering, okay, well, what do I actually do about this now? Because people are probably, hopefully, listening and thinking, oh my gosh, yes, I feel heard. I can relate to this. So, Jamie, can you give us a bit of an overview or any recommendations on how to manage imposter phenomenon?
Yeah, sure. So I looked a lot at the literature by Dr. Hutchins, who Alex already mentioned, and she looked at two main forms of coping amongst the study participants. So there's either avoidant coping or active coping. And really, the majority of people, I would say, are probably avoidant copers, myself included initially. And there's usually a prevalence or an association between avoidant coping and high imposter phenomenon. What we know is that all that does is really offer us some temporary relief from those really icky negative feelings. So, we have a drink, we watch a favorite show, we binge shop on Amazon, some of my favorite things to do. But really, ultimately, it does not address the source of the problem. So, again, treating some of those symptoms. And it leads to disengagement, denial, minimizing. Of course, it can lead to substance abuse. And in some cases, people will take on extra work and become overloaded just to avoid feeling the feels. So then she also talks about active coping, which is really what's recommended, but requires so much more work because it means that you need to seek out social support. You need to get vulnerable. You need to perhaps engage with a mental health therapist, take on more formal learning to help you understand more about some of the things behind imposter phenomenon for you. There is talk about using positive affirmations and self talk. And then, of course, cognitive reframing. So, validating your successes personally and professionally, which I would say is probably more recommended with the help of a mental health therapist. And I know that we had some really great input from Trudy, who she's a licensed practical counselor, and she really kind of highlights on the active coping parts of really being aware of your thought patterns and checking in with yourself of whether or not like this is is this an intrusive thought, is this real, like what can I compare it to in my past or in my recent history that will tell me that this is in fact not true. And just being aware of what you're feeling and being compassionate towards yourselves. I think we can all be more compassionate, and with that compassion, sharing our stories. Because if we can be vulnerable, I think we all know that leads to greater connection. And we can hopefully help each other kind of overcome this.
Awesome. Thank you. So, as we sort of start to wrap up here, we've talked a lot about some really great research. Are there any specific resources that you'd like to point listeners to?
I have one just because I've been dealing with this for a while and trying to work my way through it, right? So I found this book. It's kind of like a workbook, right? It's called Own Your Greatness. I hope I'm saying the name right. It's Lisa Orbe Austin and Richard Orbe Austin. They're both PhDs. And it's really seems to be leaning on like cognitive behavioral therapy strategies of similar to what Jamie was just saying, like identifying where all this comes from, trying to wrestle with negative thoughts that come up with you that seem to be drivers of the imposterism feelings and all that. And I think it's been super helpful for me, so it may be helpful to some of the listeners out there. Own Your Greatness by Dr. Lisa Aubrey Austin.
Thank you. And then we'll also obviously attach the systematic review that you mentioned.
Awesome. I also found this article. It's 5 steps to shake the feeling that you're an imposter. And this whole interview is really good. And just reading through it was it was awesome. It also, I think, talks about the roles of racism and oppression and acknowledging some of that too. So there's a lot in there. So I can also send you the link to that because I just found it really a good read and a good listen. It was an article published February 1, 2021, but there's a 21-minute listen that's attached to it.
Awesome. And then I know we've sort of started to touch on some of the key takeaways from your work on this, but I would love to hear just maybe one key point from each of you that is the thing that you're taking from this work, or that you would hope anyone that attended AAOMPT or anyone listening to this would take from the work.
You're not alone. You're not alone. Literally, I was up there presenting I feel like such an imposter standing up here. And then I realized I hold the keys to the research. And I know that the majority of the people in this room are feeling that way too. So that was comforting.
Yeah, second that. So comforting to know that we're not alone. And yeah, it's cool that we're driving this, but I'm just super hopeful for the people that we can help that are feeling similar things to us.
Yeah, and I hope that people can walk away with this with a bit of, again, compassion, self-compassion, really, because one, we need to have that for ourselves so that we can then be open to connecting with other people. And I think by doing that and connecting with others, that's how we're going to start changing the narrative with this.
I love all of that. Thank you guys.
I just want to give a huge shout out to this incredible team. I feel like we've all been really supportive of each other, and that's been really cool. Allison Chang has also been a part of our team, and she couldn't be here with us. And even outsiders who were not on this project helped out. Andrew Post did so much for me with the stats that we did run. And then Shamika Williams or Trudy, who is the mental health therapist that spoke with us about this, she was instrumental as well. So we just really had an incredible group, and I love this team so much.
Thank you guys so much for sharing your research and your findings, and just having a really honest, vulnerable talk with me about everything that we think is important and what physical therapists can take from this.
Thanks so much for having us.
Thank you. Thank you so much for supporting the conversation.
This is amazing. Appreciate it.
Well, again, thank you guys so much. I look forward to seeing what research and questions and answers you all come up with in the future. And hopefully we'll get some more information at the next conference as well.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at AAOMPT.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AAOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AAOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aaompt.org, which you can find in the show notes.